Optimism and confusion over COVID. That's what we'll discuss on today's Dr. Dan and Daily. Hi, everyone. John Daly here, the Daily and Dr. Dan and Daily. He is Dr. Dan O'Brien, medical futurist, who gets me and you lots of answers. Dan, where are you hanging today?
Hey, John, good to hear from you. I am in the Midwest. Here we are in Missouri, also known, John, as you know, as the Show Me State. So here we are.
Okay, well, you're going to show me a lot of stuff. So, Dr. Dan, let me act more like a patient here. I got my second Pfizer shot, and overall, not too bad. 8 hours of being tired and achy, whereas my wife had hardly anything. Is that normal?
Right, great question, John. So according to what we found in the clinical trials, with these vaccines, it really does go through a very extensive pressure test, a lot of scientific rigor, but it does show that symptoms really are quite normal as far as feeling tired or a little bit achy. It really shows that the vaccine is really working.
So you'd agree, feeling sick is actually a good sign, right?
Absolutely. It shows that your immune system is really reacting appropriately to the vaccine.
Okay, so for folks who are, going for that second shot, is there anything they can prepare? Do you have some do's and don'ts of when you're heading to that second jab?
Right. I think the first thing is just make sure, obviously, you're very well kind of equipped with knowledge as far as kind of what to expect. A few things that kind of jump out is make sure with the vaccine, with the second shot, it comes from the same manufacturer as the first shot, right? We've got two different manufacturers. I think that's definitely number one. Also, the second point is make sure that you don't take any pain relievers right before, as that can certainly kind of interfere with the safety and efficacy of that second vaccine. So I think those are two things really to make sure of at this point.
Okay, how about staying hydrated?
Absolutely. I think you make a great point with hydration. Staying hydrated is certainly crucial during that entire period.
Yeah. And don't drink a lot of booze before you go, right?
All right, exactly.
All right. This is Dr. Dan and Daily. I'm John Daly with medical futurist Dr. Dan O'Brien. Check out his website at Dr. Dan MD. That's drdanmd.com. He's also on LinkedIn at drdanmd and MBA. Okay, overall, people are, I would say, growing kind of optimistic and I would say kind of smart. A recent Axios Ipsos poll says 81% of Americans polled will keep wearing masks. 81%. 66% will stay socially distanced, even after they've gotten both shots. So, Dan, here's my question to you. Could these variants that they're talking about, could they blindside us and this optimism here in the United States?
Absolutely, John. Really with the vaccine, it really protects us for the first 2 weeks. I think that's where the crucial point is the first 2 weeks. But again, as this kind of is going through the beginning stages of, as we're learning more about the data and what it means, that's where we still need to wear masks. We still need to kind of socially distance, because even after that 2 weeks, there still is chances to be able to kind of get COVID after the vaccine. But again, you're usually, for the most part, protected within those first 2 weeks.
Tell me what you think people should picture when they see what we would call an all clear. Is there anything you can kind of point out that you go, aha, okay, now we're ready?
Right. As we see kind of a diminishing of the symptoms. And also number two, John, is the fact that once we can get 75 to 85% of people vaccinated, I think I'm going to feel a lot more comfortable out there as we get more and more people vaccinated. And again, as more data comes out, as we're kind of driving the right side of science, I think that's really crucial. Is the more data that comes out, the more that, hey, okay, this is really working. We know that people are feeling better. The numbers are going down. This way, I think we're able to find out more.
All right. So looking at the numbers, I guess the big question a lot of people are asking me is, do you see us going back to 2019? Are those days gone, or is there a whole different reality, even though we're going to get rid of this?
I'm a very optimistic person, John. So I really think that as we get back, I'm very hopeful, cautiously optimistic, right, that we get back to 2019 as far as kind of where we're at, as people are kind of living the American dream, so to speak, walking around, doing what they want to do. But it really kind of makes us think a little bit about where we're at in terms of healthcare systems and kind of where that's kind of broken down. So I do think there needs to be a lot of work in regards to continuing improving the quality of care as well as the access right now. And I think that, again, I'm cautiously optimistic that we can return to 2019, but I think overall, it's going to make people healthier. I think to look at the positive of this, people are really in tune now with their health on what the future is going to look like in regards to getting them back on the right track.
Yeah, I think you're right. I think it woke up a lot of people to what was unhealthy about what we were doing, not only here in the US, but across the world. One of the things I love about you as a medical futurist, you keep me aware of what might be happening with sports and COVID. So I'm going to ask you this. Will I go back to a packed Fenway Park this year
Right.
in the Red Sox?
Right. For all the Red Sox fans, certainly, John, I really think in the future, there will be a point in time where everyone's going to gather. I still think right now we need, according to the literature, according to the data, 75 to 80% of those people walking into the stadiums vaccinated. I think that's really crucial right now to be able to have. But again, as I look to the future, I don't think this year, I don't think in 2021, but as I look to the future years, we will be able to return. You're going to be watching your favorite team there in Fenway Park, watching the home runs, being there with the big monster, with all your favorite fans and probably your favorite beverage. So certainly a great time, in the upcoming years. But right now we have to be just kind of cautious in regards to getting more and more people vaccinated at this point.
Now you're talking. I love that.
Right.
Hey, you think at some point to go to like a game, you're going to have to show that you were vaccinated?
Absolutely. You know what, John, you're going to have to potentially have that vaccination card. And also from a public health standpoint, the fact that more hand sanitizers, there has to be more kind of guard as far as beverages and just more kind of awareness around the public health as you're allowing more and more people back in.
All right. Another great report came out this week. This is from the Airlines Reporting Association, kind of ties into what you were just talking about. It says seniors are booking a ton of flights, but they are not staying at hotels. What are they doing? They're visiting family. I get that. And I think it's fabulous, but are there any uh-ohs there? What's your take on this?
No, sure, John. Someone that loves to travel myself, I really think for the senior citizens, they're really susceptible to a lot of the chronic diseases, high blood pressure, diabetes, and cancer. And I think that it's best at this point to be, again, cautious, maybe not travel kind of around the country or, travel, globally as well. I think it's best to be conservative, to be safe, kind of stay put as we kind of see a diminishing of the numbers, just to kind of look out for family members. And again, just with those that are very susceptible to some of these diseases, you just don't want them to pick up anything.
All right, good advice. We're going to get you when you're traveling pretty soon, and when I'm traveling, and we'll kind of we'll do some remotes here to kind of get this show on the road, so to speak.
All right.
All right, Dr. Dan's house call. Here it is. It's done now. Dan, thanks. We will delve more into the next episode.
Absolutely. Thanks, John. Always a pleasure being on.
Again, he is Dr. Dan O'Brien, MD. Check out his site at drdanmd.com. He's also on LinkedIn at drdanmd. MBA. Yep, that's right. He's got some schooling behind him. And we'll see you for our next appointment on Dr. Dan and Daily. In this segment of Dr. Dan and Daily, Dr. Dan has turned into Dr. Zhivago. Hi, everybody. John Daly here with Dr. Dan O'Brien, and he has become very Omar Sharif-like. Dan, you're looking great. Where are you?
Hey, John. Great to see you. I'm out here in Keystone, Colorado, up in the slopes, doing great. The weather's fantastic. The snow is coming down, but it's still great to be outside.
All right. So you flew out there with the family, get a little skiing in. How comfortable were you on an airplane?
John, in regards to my comfort level, very comfortable. What my family and I did before, we did a lot of due diligence, a lot of homework in regards to what the airlines and the guidelines were saying in regards to the middle seats, in regards to wearing a face mask. So again, really important. And it's not 100% as far as being risk-free jumping on an airplane, but it is, according to the data, a lot safer up in the air compared to being in an office building or even a supermarket as well. So even though we can't 100% prevent it, still properly making sure we go through the guidelines is the right thing to do.
Yeah, I keep hearing a lot of experts say that really up in the plane is safer than being in the airport. Did you feel that way too?
Yes, John, I really did. I felt that it was much safer in the airplane compared to the airport. Just in the airport, the traffic is so busy. There's not as many people social distancing. So again, much safer in the airplane rather than the airports.
All right, so you're on the plane. What if the person next to you isn't wearing a mask? What should you do?
Great question, John. What we should do is the fact that maybe just politely let them know in regards to the public health guidelines that they should be wearing a mask. I think just being respectful and polite just for others around. And if not, even approach a flight attendant and say, hey, again, putting a mask on to the person next to you could be a really good idea just to protect the people on the plane, yourself, your family, everyone around you.
All right. Don't throw a drink in their face or anything like that.
Right, exactly.
All right. So you're at the ski resort there. How are things there? Is it less crowded? Are more people staying in their bungalows? Or you're not seeing as much there? Or are people just enjoying being in crowds?
Yeah, John, according to your question, much more people are actually staying in bungalows rather than being out here. I think they're enjoying at least the scenery, but people are being smarter here. People are wearing their masks, their social distancing. They are enjoying the outside, but again, people are taking the proper precautions. And it really is admirable what Denver, what the resorts, what Keystone, what they're doing here to keep people safe.
All right, this is Dr. Dan and Daly. He is Dr. Dan O'Brien, MD and MBA. A lot more initials are coming. We're going to tell you about that. You can check him out at drdanmd.com and also on LinkedIn at Dr. Dan MD MBA. So Dan, spring break is coming up. What are your recommendations? Do you let your kid go on spring break? Especially
You know
a
what, John?
college kid.
Right. In regards to recommendations, right now, according to the data, we still need about 80% of the population being vaccinated. So I would really encourage people to keep their kids home right now, especially during this time, unless they have their vaccination, which is really important. Again, we're just kind of at a critical point as more and more people are actually getting vaccinated. So we need to make sure we get, again, up to that 80 to 90% vaccinated before, again, I would feel completely safe letting my son or daughter go on spring break.
How do you, and this is kind of a psychological question. How do you get to your kid, your college kid, just to convince them? What do you do?
I think, John, some of the things you do to convince them is just keep in perspective. Again, this is kind of an interesting year, but safety is the most important thing. And I think that there's other ways that kids can really enjoy their spring break while at home, maybe with family, friends, loved ones, rather than being on a crowded beach or a crowded resort. So again, it's the right thing to do in regards to safety for your child.
All right, interesting. Some of the surveys coming out, 62% of the people in America say that if you don't have the vaccine, you can't fly on a plane. If you were working for an airline, what would you tell that airline to do?
I fully agree. I think that a percentage sounds about right as far as being vaccinated. Again, what the airlines, what I would tell them to do is have that vaccination card. Make sure as they're going up there, all the people on there are being properly vaccinated. That's really important. That's really crucial right now to keep everyone safe.
All right, this week, President Biden told the nation that everybody could be vaccinated by May 1st, and we could be celebrating with family on the 4th of July. Is the president a little too optimistic?
You know, I think the President, John's actually spot on in regards to where we're seeing the data. The numbers are actually doubling as far as where we're at as far as vaccines. So I think by the time we get to May, by the time we get to 4th of July, I think the majority of the population, we're going to get to that 80 to 90% are going to be vaccinated. And people are going to be out there enjoying their fireworks with their family and friends and their favorite beverage.
All right, you're out there. I'm inside here. I've got both my vaccinations, yet I'm still a little leery. Am I a wuss or am I smart?
You know what, John? No, you're not a wuss at all. It takes about 2 weeks after the vaccine to feel kind of completely safe. So again, properly social distancing, wearing your mask is really crucial. Give yourself those 2 weeks. So I think you're doing the right thing. You're staying safe. You're following some of the public health guidelines.
And I'm following what Dr. Dan says. All right, Dan, I'm going to let you go back to the slopes. Enjoy yourself.
Great. Will do, John. Always great to see you.
All right, as well. Folks, catch us on our next episode. This is Dr. Dan and Daly. He is Dr. Dan O'Brien, MD and MBA, and a lot more initials coming up. You'll hear about that in upcoming shows. You can check him out at drdanmd.com and also on LinkedIn at Dr. Dan, MD, MBA. I'm John Daly. We'll catch you on Dr. Dan's next house call. Great job,
Thanks, John.
Are you comfortable with that?
Yeah. What do you think, John? Still
I think it's really good, to be honest with you. I think it's really good. One of the things that I was saying to Alan was that I kind of felt bad that I thought I kind of let you down a little bit, because I should have had these a little bit more pointed to get you there. Instead, I was kind of like, oh, this is a good TV show, and it was good TV, to be honest with you. The other thing is, I think what we've got to do is we got to get you into the mindset of the yes, but. So in other words, you could say, yes, people should go out, but, or, the Democrats are saying, we need to get all this money into people's hands. It's good. Yes, but it could cause some economic problems down the road, so I think we got to kind of work you into that, so that not only do you take a stand, but you see all sides, then you take the stand. So a yes, but is good, because it kind of helps you. And I don't think I helped you with that. So when Alan had his criticism, and I said to him, I go, Alan, I said, and I look about where I started it, I think a lot of it was me. So just
no worries. John,
I
should we
think,
give it one more shot? Should we give it one more shot? You want to?
if you're ready, sure.
One more shot.
Okay, I just want to make sure
Let's
this
hit
thing's
perfection
still,
here.
Okay. In this segment of Dr. Dan and Daily, Dr. Dan has turned into Dr. Zhivago. Hi, everybody. John Daly here with Dr. Dan O'Brien, and he has become very Omar Sharif-like. Dan, you're looking good. Where are you?
Yeah, hey, John. Great to see you. I'm out here in Keystone, Colorado. Absolutely beautiful. Enjoying the slopes.
All right, so you flew out there with the family, do a little skiing. How comfortable were you getting on a plane?
You know what, John? Really comfortable. What we did is we did a lot of our homework as far as the family, right? Making sure that we were following the guidelines, looking up as far as, you know, what those guidelines are with the middle seats, with the airlines, wearing the face mask, what to kind of make sure that we're really doing. So we really, I think, felt very prepared, as well as very comfortable on the plane. Even though, again, you're not maybe 100% sure, John. Again, traveling, there's no way to kind of eliminate 100% the risk, but you can do some things to eliminate the risk on a plane. You know, for example, make sure you have your hand hygiene. Make sure, John, too, that you're staying in the window seat rather than the aisle seat. Again, as that spread of infection is a lot more common in the aisle seat. So I think doing some of these small things really makes a huge difference. And again, our family was really prepared going on the plane.
You know, and I think one of the things I keep hearing, and I think you've said this before, is the fact that sometimes an airplane is actually safer than an airport.
You're absolutely correct, John. An airplane is safer than the airport just because of the traffic. There's so much traffic right now in the airports as people are trying to get to their various destinations. A lot more safer up in the airplane.
All right, so I'm on the plane and someone next to me isn't wearing a mask. What do you do?
You know what, John? You can politely tell them just to put their mask on. Again, that's what the public health officials are doing. Or else, even too, going to a flight attendant, asking them again, could you have some assistance here, helping as far as putting a mask on the person next to you? It's just to keep yourself, your family, those around on the plane safe.
All right. At the ski resort, how was it there? Was it less crowded? Did you see more people kind of staying in their own bungalow? What was going on there?
You know what, John, according to your question, a lot more people are actually staying in their bungalow. They were enjoying time with family and friends. The slopes were not as crowded as all. People were making sure, you know, following the guidelines, wearing their mask, properly socially distancing. But to your question, much more people they're out here, but they're actually staying close. They're staying in their close quarters, again, just making sure to be being safe.
And this is Dr. Dan and Daily. He is Dr. Dan O'Brien, MD and MBA. You can check him at drdanmd.com and also on LinkedIn at Dr. Dan MD MBA. So Dan, spring break is here. What are your recommendations? Do you let your college kid go on spring break?
You know what, John, my recommendations are right now, according to the data, we need about 80% of the population being vaccinated. So we're not there right now. So I think with my kids, my son or daughter, I would keep them at home. I would look at maybe activities I could do around the house with family and friends. Just the most important thing is just keeping them safe until we have, you know, 80 to 90% vaccination in this country.
How do you talk to your kid when the kid's dying to get out there? You know, whether it's a guy or a gal, they want to get out there. How do you get to them?
Right, John. I think the first thing, just staying positive, making sure they know what the public health official guidelines are, them keeping them safe. But one thing that I think you could do is, again, spending quality time with them, you know, letting them kind of maybe look into other activities that they can kind of do around the house that they're really kind of passionate about. And again, as this kind of slows down, then I think over the upcoming years, we can let them enjoy their beach or their ski vacation.
All right, you touched on this. A recent survey says about 62% of the people say that if you don't have a vaccine, you can't fly on a plane. If you were working for an airline, what would you tell the airline to do?
You know what, John, if I was working for an airline, I would tell those people, again, you need to be vaccinated. We need to have about 80 to 90% vaccinated before we let people on the plane. Even having a little vaccine card, I think, is really crucial right now, just because if we see a surge in numbers, we don't have to go back where we were months ago. So it's really important to have that vaccine card to really get vaccinated. All
right, this week, President Biden told the nation that everybody could be vaccinated by May 1st, and we could be celebrating with family on the 4th of July. Is the president a little too optimistic?
No, John, I think the president is spot on. I think the way the numbers are in regards to people getting their vaccines, the numbers are doubling. And I think by the time we get to May 1st, even July 4th, we're going to have a good percent of the population, that 80% being vaccinated. So you're going to be out there enjoying time with your family and friends on the 4th of July.
All right. So you're out there in the cold. I'm here in the warmth inside. I've had both vaccines. I'm still a little bit leery. Am I a wuss or am I being smart?
You know what, John, you're being very smart in regards to, after getting that second vaccine, you need about 2 weeks to make sure that your body, again, is fully recovered, and the fact that you're keeping yourself safe from others as well. So given that 2 weeks is really crucial, and you're doing the right thing.
Even after the 2 weeks, should I be okay?
You know what, John? Yes. Really stay, again, I think as you kind of socially distance, you may want to still kind of wear a mask and socially distance. But yes, I would confidently say you'd be safe after those 2 weeks.
All right, Dan, I'm going to let you go socially distance back on the slope. So enjoy the skiing.
Absolutely. Thanks, John. Always great to see you.
As always, folks, catch us on our next episode. This is Dr. Dan and Daily. He is Dr. Dan O'Brien, MD and MBA. You can also check him out at drdanmd.com and also on LinkedIn at Dr. Dan MD MBA. I'm John Daly. We'll catch you on Dr. Dan's next house call.
Nice. Great. Thanks,
Dr.
John.
Dan weighs in on privacy between you and your doctor. Can you record your doctor's appointments? Hi, everybody, and welcome to Dr. Dan and Daily. I'm John Daly. He is Dr. Dan, MD, MBA, and soon an author. So, Dan, tell us where you're at.
Hey, John. Great to see you. I'm right here in Nashville, Tennessee.
All right. Well, let's dive into the topic here because there are plenty of recording artists there in Music City. But what if your doctor is against any recordings during his or her performance, let's say? I'm going to dive into an issue here that I encountered. I took my 89-year-old mother-in-law to the doctor's office. The doctor's office had a sign that said, there are absolutely no recordings allowed in the office and during patient sessions. It's curious to me because about a year earlier, I actually took my mother-in-law to the doctor after a serious diagnosis and the potential of a surgery. I recorded the session off my iPhone, so I didn't miss anything that my wife would want to hear later about her mom. Now I see that sign forbidding any recording. And if you do record, you cannot be a patient of that doctor. That's what the sign says. So let's dive into this. So Dr. Dan, give me the doctor's perspective. They're more worried about malpractice suits more than anything else there, right?
Yes, absolutely, John. It's certainly a great question. And really, according to the literature, according to the Journal of American Medical Association, it's actually legal to record, even to record secretly. But if you live in California or Florida, you must be able to have consent before you record. And of course, to answer your question in regards to malpractice, absolutely, it's on the top of all physicians' minds in regards to that. So again, the physicians really need to be aware that any conversation that they have with the patient may or may not be recorded. So they have to make sure they're making appropriate statements to the patients, and also that they're taking time to really, watch their tone and how they reflect and how they communicate to the patient.
All right. So check your state laws. That's probably the best thing. Okay. Let's, the perception
Absolutely.
for the patient of the doctor, it kind of seems like the doctors, if they're going to stop you from doing that, is that you're really, you're more concerned about yourself rather than you are about the patient. And then at the same time, too, it just seems there's so little time with a doctor anyway. And I got to think that, if you're in there, you're going to start asking the doc to give you as much information as possible in as short a period as time. So what do you think patients should do to make sure that they're going to get all this information, or when they're confronting this, you can't record, dictate?
Right, John. What I think patients should do is they should prepare questions ahead of time if the doctor has certainly any recommendations and any treatment plan. So again, coming prepared with questions is certainly crucial. And also considering asking to maybe record some of the more important information, maybe not necessarily the whole conversation, maybe some of the important aspects, even asking permission first. And again, if a patient decides not to record, maybe even have the physician take notes, hand that off to the patient. So again, you have that transparency between what's really occurring in regards to their healthcare.
All right, this is Dr. Dan and Daly. He is Dr. Dan O'Brien, MD, also an MBA. You can check him out at drdanmd.com and also on LinkedIn at Dan O'Brien, MD, MBA. So, so could you maybe create your own written agreement between your doctor and you that allows you to do recording, let's say, and you won't post it on social media, it's just for your information? Is that a good idea?
Absolutely, John. That's a great idea in regards to have that written consent between patient and physician. Again, allowing them to record, but again, maybe making sure not to post that all over social media for it to go viral. So I think that's really crucial as far as running a successful business, having that written agreement. Also, just keeping in mind a customer patient centric atmosphere too is always really crucial when running a practice. And also too, identifying ways to lower HIPAA risk. This is really important. So that could include, to your point, in making sure there's a written agreement between patient and physician at all times.
Okay. Is this something that you think you talk to lawmakers about? Maybe we need to create a blanket law that says they can record stuff.
Absolutely, John. I think they can, just because this is really going to improve the quality of care. And that's what's missing right now in this country in regards to healthcare, is this quality of care. Of course, access to is huge. So if we can improve quality of care and access with these written policies, absolutely, let's go for it.
Okay. Before we wrap it up here, give me your tips of what people should do before a doctor's appointment to make sure that your doctor is more responsive when you only have a few minutes. Give us the Dr. Dan tips.
Absolutely, John. So some of the Dr. Dan tips is make sure to make a list to prioritize before walking in to the physician's office. A list of any questions, a list of any meds is really crucial. And also, John, make sure you bring in a family member or close friend to make sure the communication that the physician is passing along is clear and there's a friend or family member. Also, make sure you're always honest right there with the physician. The more that you're able to tell your story to the physician, the more he's able to kind of give an appropriate treatment guide for next steps. And also complete any lab work prior to, of course, walking in the physician's office. So he's got all the lab work to make sure he knows where to kind of address the diagnosis and treatment.
All right. Great tips. We appreciate it. Dr. Dan, enjoy Nashville.
Absolutely, John. Always great seeing you.
As well, he is Dr. Dan O'Brien, MD, and also an MBA. We're going to be telling you more about some other initials he'll be getting after his name, and also a new book soon. You can also check him out at drdanmd.com, and he is also on LinkedIn at Dan O'Brien, MD, MBA. Dan, thanks so much. Enjoy Nashville.
Yes, absolutely, John. Always great to see you.
We have another coffee mix for you, and this one is the real deal.
We are using Aretusa rum, made by the 1233 Distillery in Little River, South Carolina.
Now, in other segments, we have profiled Aretusa, which is the name of the Prohibition-era bootlegging ship of Bill McCoy.
His libations were so good, drinkers coined the phrase, the real McCoy.
Now, we thought we'd bring it to coffee, so take a half ounce of Aretusa.
Notice the bottle is almost empty, an indication of how good this rum is.
It's a cross between gold and dark rum.
Next, add caramel macchiato cream. You decide how much cream and sugar you want.
Then brew. You will get a creamy smoothness with a hint of oak from the Aretusa, which is aged in rye whiskey barrels.
So enjoy a little 1920s history with your Morning Joe.